Good evening and welcome to Ways After Dark. And thank you so much for your patience with us. It's deadline day. Woohoo! There's not enough smiles on your faces, folks. All right. Committee Secretary, will you please call the roll?
Assemblywoman Anderson. Assemblywoman Backus. Assemblywoman Brown May. Assemblywoman Dickman. Assemblywoman Gorlow. Assemblyman Hafen. Assemblywoman Hadigi. Assemblywoman Kasama. Assemblyman Miller. Assemblyman O'Neill. Assemblywoman Peters. Assemblyman Watts. Assemblyman Yeager. Chairman Romarino.
And I am here. Will you please mark Assemblywoman Hadigi, Assemblyman Watts, and Assemblyman Yeager present as they arrive. Again, thank you for your patience with us. We should not be here too long this evening. We only have a few bills on our agenda, and with that, we will get started. But before that, if you have any electronic devices, don't forget to turn them off or mute them. Members will be using their laptops to follow along with exhibits and things, so don't think that they're being rude and inattentive. They're working. So with that, we will start the first bill on our agenda. It's Assembly Bill 147, and we welcome Assemblywoman Marzola to the table. Good evening.
Good evening, Chairman Romarino and members of the Assembly Committee on Ways and Means. I'm very excited to be here. My name is Elaine Marzola, and I represent the beautiful Assembly District 21 in Clark County. Assembly Bill 147 makes various changes relating to dentistry, including a requirement that a provider of dental services who provides their services via teledentistry must be licensed in Nevada. Additionally, this bill requires the Nevada Board of Dental Examiners to issue a special endorsement to dental providers to allow them to administer immunizations if they have completed the necessary training prescribed by the board. The accepted amendment to AB 147 did relieve the fiscal concerns, and as such, the board has removed their fiscal note for this bill. And with that, I stand for questions.
Thank you so much, and thank you for the presentation. I do have one question for you before I go to members. Would the board be able to absorb the cost with its existing reserves and fee structure since they've removed their fiscal note?
I will defer to my co-presenter.
Thank you, Madam Chair. Eddie Aveliser for the record on behalf of the Nevada Dental Association. While I can't speak for the Board of Dental Examiners, the Nevada Dental Association works very closely with the board on many issues, and I will tell you that many of our specialties do have specialty endorsement or licensed specialties that are within the parameters of the board. And so without speaking on behalf of them, and I don't know if there's a representative here for them, but we would assume that it falls within line with some of the other specialty endorsements that the dental community has.
Thank you. Is there anyone from the board here in the room that might be able to answer that question? Okay, I'm not seeing anyone. The only fiscal note that I have in my folder, and maybe I haven't updated my folder, but is the one for the $50,000. So would you reach out to them and have them submit the adjusted fiscal? Is it on? Disregard. Disregard. Members, any questions? All right, seeing none, I'll ask you to step back. And we'll invite anyone who is here in Carson City to step up to the table to testify in support of Assembly Bill 147. That's why. Seeing none, is there anyone in Las Vegas that would like to testify in support of Assembly Bill 147? Seeing none, BPS, do we have anyone joining us on the phone that would like to testify in support of Assembly Bill 147?
Chair, the line is open and working, but there are no callers choosing to testify in support at this time.
Thank you. Then we will move to the position of opposition. And is there anyone here in Carson City that would like to testify in opposition of Assembly Bill 147? Seeing none, I see one person in Las Vegas. If you're here to testify in opposition of Assembly Bill 147, I invite you to come to the table. Seeing none, in BPS, do we still not have anyone on our phone line?
Chair, there are no callers at this time.
Thank you so much. So with that, are there any final words from the presenter? Seeing none, we will close the hearing on Assembly Bill 147. And we'll move to the next item on our agenda, and that's Assembly Bill 153. Welcome back.
Thank you again, Chair and committee members. I'm still Elaine Marzola, representing District 21 in Clark County. I did sponsor Assembly Bill 153, which provides for the regulations of the practice of naprapathy. In an effort to increase access to care, naprapathy provides Nevadans another treatment option for a variety of health conditions. Doctors of naprapathy are connective tissue specialists. This measure aims to protect the public from the practice of naprapathy by unqualified and unlicensed person and from unprofessional conduct by persons who are licensed to practice naprapathy. Assembly Bill 153, first reprint, provides for the regulation of the practice of naprapathy by the State Board of Health and Division of Public and Behavioral Health of the Department of Health and Human Services and provides certain requirements governing the practice of naprapathy. Today I'm proposing two amendments, which are contained in the mock-up on Nellis. First, Section 1.32 of the bill requires an applicant for a license to practice naprapathy to pass a national examination rather than requiring the State Board of Health to prepare such tests. This requirement is also deleted in Section 1.46 of the bill. Second, Section 1.58 of the bill prescribes grounds for discipline against a napropath. The amendment provides that in addition to any criminal or civil penalty that may be imposed, the Division of Public and Behavioral Health may assess and collect all costs incurred by the division in connection with any disciplinary action taken against the naprapathy, includes costs for investigators, stenographers, attorney's fees, and other costs of the hearing. Assembly Bill 153, as amended, removed the State Board of Osteopathic Medicine's fiscal note since the responsibility regarding oversight for and regulation of naprapathy has been changed to the State Board of Health and the Division of Public and Behavioral Health. Also, the Division of Public and Behavioral Health provided a new fiscal note. It is requesting one contract physician to investigate complaints. The revenue from the fees is expected to be approximately $25,000 at the beginning, $500 a license for roughly 50 licensees. The program will absorb the cost of the regulations and cost allocation costs. Cody Finney from DHHS is here to provide additional information about the fiscal note to the committee.
Thank you so much.
Or I thought he was.
Good evening, Ms. Finney.
Oh.
Good evening. Thank you so much for having me. Cody Finney for the record. The description of the fiscal note that you just heard is accurate. We do expect to collect approximately $25,000 based on the fee, based on these amendments. And we would use that funding then to contract with a doctor of naprapathy if we needed to do a complaint-based investigation based on concerns of wrongdoing. Happy to answer any questions.
Members, any questions for Ms. Finney or the presenters? Assemblywoman Dickman.
Thank you, Madam Chair. Just want to get some confirmation on what the actual fiscal notes are at this point.
Cody Finney for the record. At this point, we would be able to collect the $25,000 a year, and we would not. We do not expect any additional costs related to this.
Okay, thanks. But there's other fiscal notes, aren't there? All of them were removed but that one? Okay.
Elaine Marzola, for the record, that is correct, Assemblywoman.
Thank you. Thanks, Chair.
Assemblywoman Backus?
Thank you, Madam Chair. And Ms. Finney, you said something that I wanted to clarify. When you were saying with the fees that would be collected, that could estimate up to $25,000 that such fees could pay for like a contracted doctor of neuropathy. I probably messed it up and I've heard the bill before. I wanted to make sure it wasn't, the intent is not to limit those fees to go directly only to that purpose of dealing with complaints, but the fees that are collected, maybe fees and fines, could go to other items like just licensing, other things like that as well.
Cody Finney, for the record. I appreciate that. The intent is at this point is that we would want to ensure we had that financing available if we needed to contract with a doctor of naturopathy. But you make an excellent point that there are other costs associated with this. And we regularly do a workload analysis and an analysis of the time that we're spending on these things. So it would be my expectation that in the future, that may be addressed through that workload analysis in future budgets. But at this time, we don't see a need for a cost above this $25,000.
I guess I'm a little confused because I'm looking at a fiscal note. You're still maintaining, though, that you require the retention of these different positions for the purpose of implementing AB 153, correct? Or are you pulling back on everything and saying that the fees would be adequate to cover everything? I just want to make sure I'm on the same page with you.
Cody Finney, for the record, I apologize for the confusion. It's my understanding at this point that the fees would cover what we need to do for this session.
I think the reason that my colleague is asking the questions on Nella's, the last fiscal note we have is after the first reprint that still had the fiscal note requiring the $483,914 for the biennium. And it says that it's going for the 1 half-time health program specialist, 1 contract physician, and 1 administrative assistant 3. Has there been an additional amendment that would take the need of that and the cost?
Cody Finney, for the record, thank you so much. Yes, that helps clarify. The additional amendments that we're talking about tonight make these changes possible. So appreciate that clarification.
Perfect, thank you. So with that, if you could send an updated fiscal note, that would be perfect, and then everything would match up. And I believe the proposed conceptual amendment, was this the amendment you were speaking of in your presentation?
Elaine Marzola, for the record, yes, Chair, and it should be uploaded on Nellis already.
Perfect, thank you. Any other questions, members? Seeing none? Thank you so much. I'll ask you to step back, take a seat, and I'll invite anyone to the table that would like to testify in support of Assembly Bill 153. Seeing none here in Carson City, do we have anyone in Las Vegas that would like to testify in support of Assembly Bill 153? Seeing none, and God bless you, members. BPS, do we have anyone joining us on the phone line that would like to testify in support of Assembly Bill 153?
Chair, there are no callers on the line at this time.
Thank you so much. Then we will move to opposition. Is there anyone in the room that would like to testify in opposition of Assembly Bill 153? Seeing none. There's one person in Las Vegas. Are you here to testify in opposition of 153? If you are, move up to the table. Not seeing any movement, then we'll go to the position of neutral. If you are here to testify in neutral on Assembly Bill 153, I invite you to the table. Good evening.
Madam Chair and Committee, Susan Fisher for the record, speaking with McDonald Corano, speaking today on behalf of Nevada State Board of Osteopathic Medicine. We also had submitted a fiscal note because the bill in its original format would have the regulation being done under the Board of Osteopathic Medicine. However, that's been amended, and we have submitted a new fiscal note to erase that one, to say it's a zero fiscal note for us. Thank you.
Thank you, and I did receive that. Thank you so much. Is there anyone else that would like to testify in the position of neutral here in Carson City? And seeing no one in Las Vegas, I'm assuming there's still no one who's joined us on the phone lines. Is that correct?
Yes, Madam Chairwoman.
Thank you so much. Are there any closing comments? All right, so with that, we will close the hearing on Assembly Bill 153. Thank you for joining us tonight. And we will open the hearing on Assembly Bill 260. Good evening, Assemblyman O'Neill. A little bouncy there.
I've had my chocolate. We can go all night.
Then you can get started whenever you want.
Thank you, Chair Moreno and members of the committee. I'm here to present to, I'm P.K. O'Neill, Assemblyman for District 40. I'm here to present to you an outstanding bill that is probably one of the cheapest ones you will see, the benefits that we will derive from it for the state of Nevada. But seriously speaking, for your consideration, I have Assembly Bill 260, which will exempt officers and agents of veteran service organizations from their annual registration fees imposed by the Secretary of the State's office. I just want to clarify that the bill only exempts federally recognized veteran service organizations and their officers and agents of these organizations when making business entity filings related to the veteran service organizations. The bill does not in any way exempt or influence businesses which are owned by veterans from their licensing fee or other business entity filing fees under Title S of NRS. There is unfortunately a fiscal note of $4,500 a year, $9,000 for the biennium that the Secretary of State's office has put on there for their loss of revenue. And I'm available for any questions, and Gabriel from the SOS is right here to explain how I'm bankrupting them.
Good evening, the bankrupt manager? I don't know. Good evening. Would you go ahead and just explain the fiscal note? Thank you.
Yes, Madam Chair. Thank you very much. Gabriel DeCara, for the record, Chief Deputy Secretary of State. We initially entered a note of no fiscal impact, but were informed that it does in fact have a fiscal impact and we should calculate it. So we looked at the list of how many of the federally identified veteran service organizations there are in the state of Nevada, did the math on what it would cost us for their annual lists to go unpaid. And that is how we came up with the $4,500 a year fiscal note. Obviously, that note would increase, which would drive us even further into poverty where there are more veteran service organizations. However, I believe that that's a somewhat lengthy process to become federally recognized, so we would have time to look through the couch cushions.
And I'm sure Assemblyman O'Neill would help you look through the couch cushions to find those resources. All right, members, I think we've had too much chocolate today. Members, any questions for the presenters? See none. All right. I do have a question. When you looked at the numbers, what is the approximate number right now of veterans that this would?
Thank you for the question, Madam Chair. Gabriel DeCara, for the record. I believe it is 42. It is on the Veterans Department Administration website for the state of Nevada.
Okay. Thank you. Seeing no other questions from our members, I'll ask you both to step back unless there's something more you want to add. Okay. And I'll invite anyone to the table that'd like to testify in support of Assembly Bill 260.
Good evening. Thank you, Madam Chair, members of the committee. For the record, Darrell Brown, representing Chairman Andy LaPilba of the United Veterans Legislative Council. We are in support of AB 262. 260. It is an excellent bill. Thank you, Assemblyman O'Neill, for bringing it forward. It is not necessarily the fee, it's the onus of filing that officer's report every year. I did that for several years as president of the local Vietnam Veterans of America chapter and for the president of the Nevada State Council of Vietnam Veterans of America. So it's not drudgery, but it's just one of those things that's like, oh my goodness, it's due again. So this bill will relieve that for us, and we appreciate a very favorable decision from the committee, and I'm happy to answer any questions you may have.
Thank you so much. I don't think we have any questions from you, but we appreciate your testimony tonight.
Thank you, ma'am.
Thank you. Not seeing anyone move to the table in Las Vegas to testify in support of Assembly Bill 260, we'll go to the phone lines. BPS, have we had anyone join us on the phones tonight?
Chair, there are no callers this time.
Thank you so much. We'll move to opposition. Is there anyone here to testify in opposition of Assembly Bill 260? Seeing none, and not seeing anyone move to the table in Las Vegas, and knowing that we do not have anyone who's joined us on the phone lines, I will ask the presenters if you have any closing remarks before we close the hearing on 260.
Very quickly, I remembered when veterans were talking, a lot of these veterans organizations are fairly small, and they're also aging. And even though the cost is nominal, it is getting difficult for them, for the funds the officers are actually dipping into their own pockets to pay for it. So I just wanted to add that part in. So I do appreciate the consideration of the committee. Thank you, Chair.
Thank you, and thank you for that additional information. And with that, members, we will close the hearing on Assembly Bill 260, and we will open the hearing on Assembly Bill 263. Good evening.
Good evening, Madam Chair, members of the committee. For the record, Howard Watts, representing Assembly District 15. It's my pleasure to present Assembly Bill 263 for your consideration today. This bill institutes certain requirements for water management plans and the engagement of certain trained professionals in the development and execution of those water management plans for certain covered healthcare facilities, particularly aimed at reducing the transmission of Legionnaire's disease throughout our community and throughout these facilities, and to ensure that those medically fragile populations are not impacted by this. Speaking to the fiscal aspect, you will see that there was an unsolicited fiscal note submitted based on the first reprint of the bill. You should also have before you a proposed conceptual amendment that narrows the definition of covered healthcare facilities to include intermediate care facilities that are CMS certified nursing homes, facilities for skilled nursing that are CMS certified skilled nursing homes, and hospitals that are CMS certified as a hospital or critical access hospital. By narrowing those requirements, that lines up with certain water quality plans that are already required by the federal government through CMS, and that would result in reducing and I think getting close to eliminating. We'll have the division come up and speak to that about from healthcare quality and compliance. But by narrowing this down, this should get the fiscal note at or very close to zero by making sure that the scope of work that they do is not included. And with that, I'll turn it over.
Thank you. Good evening.
Hello, this is Letitia Metherell with the Division of Public and Behavioral Health, here to confirm that the conceptual amendment would remove the fiscal note completely.
That concludes my presentation.
That's a great place to stop, yes. Members, any questions for the presenter? I do have one. How many cases recently have we had of Legionnaire's disease here in Nevada, and then in the senior citizens' homes that this bill addresses?
Thank you for that question, Madam Chair. Howard Watts for the record. I will have to follow up with some of that information. I know in Nevada we have not had a lot of issues with Legionnaires in healthcare facilities. We have had some issues in resorts a few times, but it does happen. It does come up from time to time. And I will say that nationally, the number one area where Legionnaire's disease outbreaks occur is within healthcare facilities. And so, and again, due to the fact that we've got folks that are medically fragile in those facilities, we don't want to risk adding the infection with Legionnaire's disease on top of that. And that's why that's the focus of this piece of legislation. But we can follow up. I believe that there is some public health information about that we can get to the members of the committee.
Thank you. Members, any other questions? Maybe too much chocolate and people are tired, so. Go ahead and step back, and we'll invite anyone to the table that'd like to testify in support of Assembly Bill 263. Not seeing anyone step up to the table here in Carson City or in Las Vegas, BPS. Have we had anyone join us on the phone lines?
Chair, there are no callers this time.
Thank you so much. Then we'll move to the position of opposition. If there's anyone here in Carson City who'd like to testify in opposition of Assembly Bill 263, I invite you to the table. Good evening.
Good evening, Madam Chair, members of the committee. John Lelu here on behalf of the Alliance to Prevent Legionnaire's Disease. I would like to start off by saying thank you to my friend Assemblyman Watts for bringing this bill and for being so open with us and speaking with us almost every day since we came on to this matter to answer all of our questions. Assemblyman Watts is always very easy to work with, and we look forward to working with him, to continue working with him on this matter. The reason why the Alliance opposes this bill is simply because AB 263, as it's currently constructed, will not reduce Legionnaire's disease. And in that regard, before your committee, Madam Chair, a penny spent is a penny wasted. As you just asked, how many instances do we have in the state of Nevada of Legionnaire's disease in healthcare facilities? We agree with Assemblyman Watts. There aren't many. In fact, Legionnaire's is a reportable disease through the CDC. You can easily get that information. The answer is none in recent memory. Instances of in healthcare facilities are extremely rare. We're aware of none in Nevada. CMS, Medicaid facilities already have requirements in place for water management programs in the facilities. So this bill is unnecessary, and by adding proprietary training and certification, as well as routine testing requirements, it adds substantial costs all in facilities where we don't have any recent recorded instances of Legionnaires. Now, the amendment the conceptual amendment that Assemblyman Watts has offered removes state hospitals, which reduces the fiscal note to zero, but focuses its intent on private Medicare, Medicaid facilities, as well as UMC in Clark County. So it's not as if this bill is without costs. It's just shifting the costs to other folks. Our concern is that this bill already exempts rural hospitals from coverage. The amendment will release state hospitals from coverage. And so we're wondering, by continuing to release hospital after hospital from coverage of this bill, simply to overcome the financial hurdles that are inherent in this bill, we need to show some type of rational basis why some hospitals should undergo this testing and some should not. proponents don't offer anything like that. So there is no rational basis to treat the healthcare facilities differently. The proponents do need to explain why mandatory certification and training and testing is for the waterborne bacteria in some facilities it's necessary, and others it's not. So this won't pass rational basis scrutiny. So the Alliance objects to mandatory testing since it is not recommended by the World Health Organization as a control method for Legionnaires. The association that sets forth the standards for water testing, ASHRAE, doesn't include it. The CDC toolkit doesn't include it. And CMS regulations on healthcare facilities don't include it. Now, the Alliance, my client, is a national nonprofit with the exclusive mission of combating Legionnaire's disease and reducing cases. We are very thankful that Howard has brought this bill, that Assemblyman Watts has brought this bill, because he is raising awareness. We want to continue working with him on this issue. Each of you has received a white paper detailing substantial issues with this legislation, but that doesn't mean that addressing Legionnaires is off the table. We want to do that, and we want to do that along with the bill sponsor. The problem is that this particular legislation has been tried in state legislatures and most recently was vetoed in California. The bill, honestly, is a distraction from the main issue. The bill's costly. It wastes limited resources that could go to true prevention and water quality management to reduce cases. And as a result, the bill, as it stands, should not pass. But again, we want to continue working with Assemblyman Watts on this issue. Thank you.
Thank you. Go ahead.
Madam Chair and members of the committee, for the record, my name is Brett Salmon with the Nevada Healthcare Association. We represent both skilled nursing and assisted living facilities throughout the state. Also want to thank Assemblyman Watts for his consideration in allowing us to visit with him often on this piece of legislation. You've all received my letter on Nellis where it describes the concerns that we have. I'm just going to focus on the data and how we're really the wrong target. And I'm going to focus on just assisted livings and long-term care facilities. If you look up in my letter, the National Outbreak Reporting System, which is the reporting system for reporting these type of illnesses and diseases on the CDC website, 83% in the last 20 years of nationwide Legionella outbreaks occurred outside of a long-term care setting. 88% of nationwide Legionella illnesses occurred, the illnesses have occurred outside of long-term care. 85% Legionella hospitalizations originated from outside long-term care. And 73% of Legionella deaths in the United States in the past 20 years occurred outside of long-term care. So we're a little bit confused as to why this should apply to us. We have lots of regulation, both state and federal regulation on Legionella that we currently have water management plans for. And on the data as it pertains to Clark County and Washoe County, Nevada specific data. Clark County averages about 20.3 according to the records I found from the Southern Nevada Health District. That's just overall, not health facility specific, and Washoe County has about one per year in the last 10 years. And so Nevada is not a place that has lots of Legionella, fortunately, we just feel like this is maybe needs to be targeted in other places. And just to respond to Assemblyman Watts, respectfully, I spent a lot of time on that NORS outbreak system, and healthcare facilities are not the number one source of Legionella. It's other healthcare facilities. If you look on that link in my letter, it'll show you that. So thank you very much.
Thank you. Good evening.
Good evening. My name's Patrick Kelly with the Nevada Hospital Association. Because of the late hour, I'm going to make 4 quick points. Number 1, hospitals are required by CMS and the Joint Commission to have water management plans. 2, we're unaware of any incidences of Legionnaire's disease in Nevada hospitals. 3, we're concerned about the costs related to ASSE certification. And 4, AB 263 will increase costs with little to no benefit. Thank you.
Thank you. Is there anyone else here in Carson City that'd like to testify in opposition of Assembly Bill 263. Seeing none and not seeing anyone come to the table in Las Vegas. BPS, have we had anyone join us on the phone lines?
Chair, there are no callers at this time.
Thank you so much, and we'll move to the position of neutral. Is there anyone here in Carson City that'd like to testify in the neutral on Assembly Bill 263? Good evening.
Good evening. Jessica Adams, Deputy Administrator with the Aging and Disability Services Division. We had a small fiscal note on this bill with the conceptual amendment that is lifted, so we have no fiscal note now.
Thank you so much for getting that on the record. Awesome. So, any closing remarks?
Thank you, Madam Chair. Howard Watts for the record. I'll keep this very brief. Just to respond, a couple of things. So again, by aligning this with CMS, as you've heard, there is already a requirement for those CMS facilities to have water management plans. What we're trying to do is make sure that we have state policy to match that, and that we make sure that we have somebody who is extremely qualified involved in the design and administration of that plan. I'm not going to debate or dispute the statistics, but I think one person getting gravely ill or passing away from Legionnaire's disease that we could prevent by being proactive is too many. So again, with regards to having that plan in place, that's something that's already a requirement through the federal government. And ultimately, we are not asking folks to hire a dedicated person on staff. They could contract with somebody. Somebody can work with many different CMS certified facilities that would be covered under these provisions. We just want to make sure that an expert is involved in the design and execution of these programs. So thank you all very much for your consideration.
Before you step away, we do have one question for you, Assemblyman Haven.
Yeah, thank you, Madam Chair. And I apologize for not asking earlier, but you just mentioned that you wanted a qualified individual. Did you change the original language in the bill from on that qualified individual, or is that still the same language?
Howard Watts for the record. Thank you for that question, Assemblyman. All that has changed since the policy committee with this amendment is the types of healthcare facilities that have been covered. So the qualifications and who has to have one of those individuals involved in developing and implementing those plans has not changed since the policy hearing.
So just for clarification, we are still saying that a licensed water operator licensed by the NDEP is still not qualified enough to do this job, correct?
Howard Watts for the record. So they can certainly be involved in the design and carrying out of these plans. What we want to have is somebody that has the specific additional training in addressing Legionella to be involved as well.
Was that it, Assemblyman Haven? Looks like you have. Okay, thank you. And with that, we will close the hearing on Assembly Bill 263, and we will take a 1-minute recess.
We'll go ahead and get this meeting back to order. With that, we would invite Chair Monroe Marino up to present Assembly Bill 310. So I'll go ahead and open the hearing on Assembly Bill 310, and please start when you guys are ready.
Good evening, Madam Vice Chair and members of the Assembly Ways and Means Committee, and thank you for the opportunity to present Assembly Bill 310. Assembly Bill 310 is a measure that creates the Nevada Supportive Housing Development Fund with an appropriation of $30 million over the biennium within the Nevada Housing Division, with oversight and capacity support by the Interagency Council on Homelessness to Housing, and an additional $1.5 million appropriation to the Nevada Housing Division for provider capacity building grants to assist supportive housing partnerships to facilitate staffing support, training, and technical assistance. Joining me here tonight is Ms. Christine Hess, here at the table with me, the Executive Director for Nevada Housing Coalition. And by Zoom, we have Ms. Brooke Page, Director of the Southwest Geography Corporation of Supportive Housing, otherwise known as CSH. And with your permission, I will turn the presentation over to Ms. Page for a brief overview of the program, and then we can talk about the fiscal aspects of it.
Great, thank you so much. Good afternoon, everyone. As Chairwoman Monroe mentioned, my name is Brooke Page, and I would like to give a brief overview of this bill. We are in partnership with the Nevada Housing Coalition. The AB 310 provides an opportunity to develop the infrastructure in Nevada to scale what is going on currently, but not necessarily being tracked, is an opportunity for us to scale supportive housing. And so you all should have a two-pager that provides an overview of this presentation and what supportive housing is. I'm just going to share my screen briefly and show the bottom of the two-pager provides an example of what supportive housing is and kind of how we are defining it in AB 310. But just some important points. Supportive housing, it combines affordable housing with supportive services. And this helps to provide folks that are facing the most complex challenges with stability, autonomy, and dignity. It improves employment, mental health, physical health, substance abuse, and it reduces active substance use. And so we really want to kind of emphasize that point because this is the intervention that's going to help us address our homelessness need in the state of Nevada. Another example that I'd like to share is at the bottom of page 2 of the two-pager that we've provided. Some important notes here is the fact that supportive housing is a cost-effective intervention. And what you'll notice on this page is, it's important that supportive housing is saving lives, but it's also important to know that states across the country are also showing major cost offsets. Folks that are cycling in the revolving door of homelessness in and out of jails and emergency shelters is not a cost-effective way to address the need in our communities. In Denver, the social impact bond, they conducted a very rigorous randomized control trial. They showed and demonstrated that $25,000 a year per person per year was cost offsets that they saw when they tracked a person by putting them in supportive housing versus keeping them cycling in and out of high cost systems. And in our neighbor state in Arizona, the state Medicaid program showed remarkably $66,756 per member per year was the cost offsets that they're seeing in their Medicaid program. So with the infrastructure, we're able to do this here in Nevada. So that's a bit about the bill. I'll take a pause here, Assemblywoman, if you want me to go into the details of the amounts.
No, thank you so much, Danielle Monroe Moreno, for the record. Members, the flyer that she's referring to is uploaded on Nella's for you to see. There is a fiscal note on this bill, and when you look at the fiscal notes from the Department of Business and Industry, Nevada Housing Division, in year FY 23-24, it has a $0 amount. However, in FY 24-25, it's $282,302 with a $564,604 over the future biennium. And I believe there is a representative here to address the fiscal notes if necessary. However, it's in my opinion, as a fiscal leader in this body, that to ensure the success of this pilot program, the fiscal notes submitted are more than reasonable. Roughly 7,000 Nevadans are experiencing homelessness and are unnecessarily at times kept in some of our institutional facilities. As mentioned by Ms. Page, where the cost of being in jail and shelters and hospitals or left on the streets can cost up to $40,000 per person per year. So therefore, the need for affordable housing with supportive services is vital for the state of Nevada. Supportive housing is an evidence-based intervention that can address this need, and it requires dedicated funding and support in its development. There was an amendment in the policy committee because the question came up of how we sustain the funding for this. This is a pilot program with this one-time influx of funding, but we added that the fund could accept donations, contributions, and apply for grants. So with that, I have two phone a friends. We will stand for questions.
Thank you so much for your presentation. Committee members, does anyone have any questions on this bill? With that, I'll go ahead and ask two little questions. One, looking at fiscal year 2023-24, I understand that there was interest on the revenue of the $32.2 million in the sum of $135,240, and we have a note from our wonderful fiscal staff that this estimate, this estimated treasurer's interest may not be accrued on general fund appropriations. And so with that, would that then simply, would the intent be, and it's not your fiscal note, but I would anticipate that that would just reduce the grant expense for that fiscal year?
Correct, and Danielle Monroe Moreno for the record, and thank you for the question. Yes, in speaking with the LCB fiscal staff, it was determined that the treasurer's interest would not be able to use as a revenue generator for this fund, so therefore we would have to reduce the amount of the grants by that amount.
Thank you so much for that. And then the next question I have is, for the funding for fiscal year 2025, how do you anticipate to that these funds will be supported in years to come?
Thank you so much for the question. Danielle Monroe Moreno for the record. As I stated, the fund would be able to accept grants, accept donations and contributions. But we also believe, and in conversations with some of our members of our federal delegation, there are federal dollars that we could bring in to help support the fund.
Thank you so much. With that, and not having, we do have a question. Assemblywoman Brown May.
Thank you. Thank you for your presentation. And I think it's more a comment, right? I want to acknowledge the good work that you've done relative to the positive fiscal impacts, even though we're looking at a big fiscal note. And many years ago, Malcolm Gladwell, I believe, published an article called $1 Million Murray, which supported the amount of money we spend as a community in support services to care for this population. So this looks like it would decrease the investment per person based on that article. Is that accurate?
Yes, thank you so much, Assemblywoman Brown May. Christine Hess with the Nevada Housing Coalition for the record. You're exactly right. That's what this bill will show. What's really important, I think, is as you look at the funding, we are tracking the outcomes. Another significant detail, because they track the outcomes, measured the outcomes, after 3 years, 77% of those they housed that were unhoused maintained stable housing, right? They're not in the cycle anymore. Thank you.
Thank you so much. Are there any other further questions? I just want to correct something. I found something really cool in your bill that under Section 3, subsection 3, the language does provide that any basically interest earned on the deposit or investment of the money in the fund after deducting any applicable charges must be credited to the fund. So the fiscal note for that $135,000 can stay, and we don't have to decrease the grants.
Danielle Monroe Moreno, thank you.
With that, the presenters can take a step back. So while they're doing that, I'll go ahead and start in Las Vegas. Is there anybody in Las Vegas wishing to give testimony in support of Assembly Bill 310? Doesn't look like it. So we will come here to Carson City. Anyone wishing to give testimony in support of Assembly Bill 310, please come forward, and you guys can start when you get seated. Thank you.
Good evening, Madam Vice Chair, members of the committee. For the record, my name is Cadence Matievich, representing Washoe County. Here in strong support of this bill, this is a significant investment. We believe that the return on the investment will be well worth it, and we urge your support. Thank you.
Thank you, members of the committee. My name is Esther Badiata with Sala Consulting, representing Silver Summit Health Plan. This bill addresses the lack of supportive housing in our state with solutions that will have a direct and positive impact. As a Medicaid insurer, Silver Summit knows firsthand the importance of programs that support vulnerable populations and seeks to address the source of challenges they are experiencing. We applaud this effort to meaningfully expand such services and want to say thank you to Chair Monroe Moreno for sponsoring this bill, and we are in full support.
Good evening to members of the Ways and Means Committee. Joanna Jacob on behalf of Clark County. We'd like to thank the sponsor for her tireless efforts to find some funding and a sustainable funding source also for supportive housing. Clark County believes that this is going to be a real need that we see in our homeless programming. Once stabilized, we've invested money, significant funds on homeless programming, but once stabilized, we know that there are many of our homeless constituents who need supportive housing in order to stay stabilized and housed. So we really appreciate the scope of this bill, the funding that's included, and all of the work of all the stakeholders that have gotten it to this point. So we are in strong support and urge your support as well. Thank you.
Thank you, Vice Chair and members of the committee. For the record, my name is Amanda Brazo with Nevada Hand. Nevada Hand supports AB 310. We believe it's important to ensure supportive housing is accessible for those who need it. This bill will help fill a critical need in our community, and we'd like to thank the bill sponsor and the Corporation for Supportive Housing for their work on this measure. Thank you.
Thank you so much. We will go to the phone lines. BPS, is there anyone on the phone lines wishing to give testimony in support to Assembly Bill 310?
There are no callers at this time.
Thank you so much. Next, we will go to testimony in opposition to Assembly Bill 310. I don't see anyone in Las Vegas, but if there is anyone in Las Vegas, please make your way to the dais if you have any testimony in opposition to Assembly Bill 310. Okay, we can come down to Carson City. Is there anyone here in Carson City wishing to give testimony in opposition to Assembly Bill 310? Doesn't look like it. BPS, has anyone joined the phone line wishing to give testimony in opposition to Assembly Bill 310?
There are no callers at this time.
Fantastic. We will move to testimony in neutral. Is there anyone in Las Vegas wishing to give testimony in the neutral to Assembly Bill 310? We'll come to Carson City. Is there anyone here in Carson City wishing to give neutral testimony to Assembly Bill 310? BPS, has anyone possibly joined the phone line wishing to give testimony in the neutral to Assembly Bill 310?
There are no callers at this time.
Fantastic. I will invite the bill sponsor back up. Nope, she will waive closing comments. With that, we can close the hearing on Assembly Bill 310. And we'll take a 1-minute recess.
Good evening. So we will bring the meeting back to order, and that brings us to the last item on our agenda for tonight, and that is public comment. So if there's anyone here in Carson City that would like to make public comment, I invite you to come up to the table. I think we lost the one person we had in Las Vegas, so I don't think there's anyone there for public comment. But not seeing anyone here in Carson City. BPS, do we have anyone on our phone lines that would like to make public comment tonight?
Chair, there are no callers on the line.
All righty then. Then that brings us to the end of this meeting. I know some people might have one more committee before we go to floor. Our night's almost over, and then I'll see you bright and early in the morning. No, there's no Saturday committee. Gotcha. All right, with that, this meeting is adjourned.